Hey guys, Dr. Utash here, Wellness Key Chiropractic. Welcome to the office. I want to go over what you can expect if you had a lower back, possibly a hip, or even back pain or radiation pain down the leg, like a sciatic pain, maybe even numbness tingling in the feet and the toes. This is what an exam process or what it would look like in the office if you presented with a complaint like similar to that. So first of all, we'd invite you to a private room after filling out the intake forms. You can do those online, or you could do them here in the office. After arriving for your scheduled appointment, we take you back to the private room and we discuss ultimately your problem, how long it's been there, and then what you think might have caused it. And so we're going to go into your previous health history, surgeries, falls, accidents, injuries, if you're a female, pregnancies. All of these things matter. Once we get an idea of what might have caused some of this issue, then we can talk about some of the goals and some of the things it's keeping you from. So maybe it's soccer, maybe it's picking up the kids, maybe it's just being comfortable on your drive to and from work or sitting at your computer desk. We're going to set up some specific goals for you so that way we know that we're winning. After the consultation and the goal setting, we're going to talk about the physical exam. So if we're coming in with a low back complaint or a complaint that radiates down into a lower extremity, like a leg, a butt, a hip, or down into your toes and feet, we're typically going to focus on the lower part of the spine. So we know in the lower back, these are the nerves that go out to the back muscles, to the groin, to the hips, and then down into the legs. And so when this spine is shifted out of its normal position, maybe you sit with legs crossed like this, or perhaps you had an injury, all of that's going to alter the spinal position and also create a fixation or an area that's stuck. That's called subluxation. That's going to irritate these nerves coming out. That might be the cause of that lower back pain or pain that radiates down into the leg. So the physical exam will consist of you laying down on the table, face down initially, and we do things like look at your leg length, and we can see, hey, if you have a short leg, what does that mean? Typically it means that the pelvis has been rotated. The muscles in the back maybe are contracting unevenly, and it's pulling that leg up. It's not that it's actually a short leg. So we're gonna look for that. We're gonna mark that down. We're gonna have you lift your legs up individually. We're gonna see how high and if they do it evenly, right? You're gonna let me know if there's pain or discomfort on either of those. All of these spinal bones matter because in between each of those is the disc, and then that creates a space for the nerve to come out. And so we're gonna feel from your pelvis to your sacrum to all of these spinal joints and bones, we're gonna see if they're moving properly. They should all be moving independently just like your fingers. When they're not, we'll write it down. We know that the nerves in the lower back, they go down to the back, the butt, and then down to the legs, but they also go to your internal organs as well. So the nerves in the lower back, they go to things like your colon, reproductive system. So oftentimes with back pain or sciatic pain, we might notice constipation, diarrhea, gas, bloating, very common symptoms when we're dealing with low back pain and pain that radiates down the leg. We'll continue the exam all the way up the spine. So 5 bones in the lower back, the sacrum and the pelvis. Then we have our 12 bones in the middle back, the thoracic spine, and then the cervical spine. And then ultimately, we're going to see how each of these things move. After the hands-on physical exam, we'll sit you up, and we'll go over to these posters over here. And we'll be able to see, and you'll be able to see, what we're talking about. And so, let's say, for example, it was stuck in the very low back on the left-hand side. And so we'll point this out, and then you'll be able to clearly see that the nerves in the lower back on the left-hand side go to your back muscles. They kind of form that sciatic nerve that goes down your rear end, down the back of your leg, and then all the way into your feet and toes. Might be causing the pain, the radiation of symptoms, the numbness and tingling, and of course the back pain. We'll go over each of those bones that were stuck that we discussed during the exam, and then from there, most likely we'll recommend some range of motion. So a lot of the times we know that there's some baseline normals, but we'll have you bend from side to side. We'll measure that and we'll see. So, 35 is normal and you can go 35 degrees this way and 15 degrees this way, there's a problem there, right? Based on that physical exam, based on the range of motion, we'll take some necessary x-rays. Now, in the case of a low back chief complaint, we're gonna take a lumbar series. So our office is a little bit different, so we'll take functional x-rays. So we'll take an x-ray from straight on. So we'll see that spine is straight, the pelvis is level, and then we'll take one from the side view, which is where we should see that nice curvature in the spine. We'll be able to see that there's bones there that are separated by a good disc space, which creates a healthy hole for that nerve to come out. And then, most importantly, and really what differentiates us, is we'll take that spine and take an x-ray in motion. So bending to the left, bending to the right, we'll be able to see some normal biomechanics that you might be compensating for if you're just doing regular range of motion. And this is where we really get to find some of the things that maybe other places have missed, or maybe another doctor has missed. So when you bend to the left, all of those spinous processes should spin, that disc should pinch, and we'll be able to see that on x-ray, and then that'll really help us to guide our treatment and our adjustment and our care here in the office so you get the fastest results possible. So after the x-rays, after the range of motion, after the exam and consultation, we'll take you up to the front and we'll schedule a time to go over those x-rays with you in person. And so give us a little bit of time. The doctors and I will go over all the results together first, and then when you come back, we'll be ready for you. We'll have looked at your case history, we'll look at your file, we'll look at your x-rays, your range of motion, and then we'll invite you back into a room like this and we'll go over it together. So for example, we'll go over the normal x-rays first. So an x-ray, again, should be straight from the front, pelvis should be level, all those spinuses should be in a row. When we have you bend to the side, normal x-rays, we should see that spinous process, spin to the left, pinching of the disc, opening of that disc space on the other side. These are normal biomechanics. And then of course, if we look at it from the low back from the side, we should see a nice curve like a banana, smooth square bones, and a good healthy disc space that creates a hole for the nerve to come out. So we went over normals, now we would look at yours. And so when we pull up yours, you'll be able to see what's normal, what's not normal, and what are the areas that we need to work on. So in this case, relatively level pelvis, the spine starts to shift a little bit to the side there. As we go and look at the next one, where we should see these spinous processes spinning to the right, it isn't happening. And it's that clear. And that's what's so awesome, is we're able to see what's not working, what's the cause of the problem and the pain that you've been suffering with, and then ultimately what we need to start correcting that. So in this particular case, we would have you, for care, we'd actually have you start that process with your first adjustment. And so on a table just similar to the one here we have in front of us, we'd have you lay face down, x-rays are pulled up, and then we're able to make a specific adjustment, either using a drop table, which can be very gentle, or even if you're really nervous, we could even use a low force tool to begin getting that spine moving in the right direction, taking the stress off of that nervous system, which allows your body to heal itself. Again, healing doesn't happen overnight, it's a process. And so we start that adjustment with the first adjustment, and then before you leave and hop in your car and go home, we'll do some simple rehab exercises here in the office. And so after the adjustment, slowly get you up and take you over to one of our vibration platforms. This is gonna help strengthen and stabilize the spine. And so after the adjustment, we're gonna help keep that tummy nice and tight. We're gonna help hold that adjustment, so that way, again, the longer you hold the adjustment, the faster you get better. And we work on all the soft tissue around that to help strengthen and stabilize it, so it doesn't just keep coming back again and again and again. We actually get some improvement over time. Can't wait to see you soon.